Brain scan in the diagnosis of ADHD. Attention deficit hyperactivity disorder is a neurodevelopmental disorder that's usually diagnosed during childhood and can last into adulthood. Experts estimate that about 5 to 7% of children and adolescents worldwide have attention disorder, which is marked by issues with attention and hyperactivity. ADHD is a disorder of the brain characterized by periods of inattention, hyperactivity and impulsive behavior. Currently, the diagnosis of ADHD is based on descriptions of parent and teachers and assessment of the behavioral patterns of the child. A study in the journal, Radiology on August 24, 2017 says, MRI neuroimaging may help to identify people with ADHD and help to distinguish between different subtypes of the disorder. Dr. Kaiyong Gong, at West China Hospital of Sichuan University in Chengdu, China is the study author. The scientists found that 3 of the brain regions were shaped differently in ADHD children. The researchers were able to correlate the brain's activity to the diagnosis to one of the 3 specific subtypes of ADHD. Predominantly inattentive, predominantly hyperactive and impulsive, or a mix of the 2. No change was found in total brain volume or total gray and white matter volumes of ADHD children. The 3 brain regions that were found to have different shapes were the left temporal lobe, the bilateral cuneus and the left central sulcus. The temporal lobe is known for its role in speech and comprehension, while the cuneus is linked to visual processing and the central sulcus is a fold that separates different parts of the brain with different functions. The main aim of the current study was to establish classification models that can assist the psychiatrist or clinical psychologist in diagnosing and subtyping of ADHD based on relevant radiomics signatures. This imaging-based classification model could be an objective adjunct to facilitate better clinical decision-making. Psychoradiology, which applies imaging data analysis to mental health and neurological conditions, has emerged in recent years as a promising tool for helping to clarify diagnoses. The present study adds to the developing field of psychoradiology. Cerebral radiomics is the extraction of a large amount of quantitative information from digital imaging features that can be mined for disease characteristics. Radiomics, combined with other patient characteristics, improve diagnostic power and help in the diagnostic and treatment planning decisions in patients with other psychiatric disorders also. The radiomics signatures allowed discrimination of ADHD patients and healthy control children with 74% accuracy and discrimination of ADHD inattentive and ADHD combined subtypes with 80% accuracy. However, the evaluations and the overlap of ADHD with other psychiatric disorders, imaging-based parameters may provide a useful objective adjunct to clinical psychiatric evaluation for diagnosing and subtyping ADHD. Thank you.